Hi, I'm Prakash. I've been asked by Dr. Arunachalam to answer a few questions on evidence-based practice which he received. So the first question is, what is your explanation about people saying science is evolving and the approaches which do not have evidence today may come up with evidence tomorrow? Now, this is a very common argument that is made when evidence doesn't support a new treatment. Now, the first question we should explore to answer this question is that the reason why a new treatment does not have evidence to support, because we think in future it may, but what is the reason why the evidence is not supporting? Let us say, for example, kinesiological taping. Now, evidence doesn't support its use. Evidence shows that it doesn't improve anything. Now, why evidence doesn't support? Because kinesiological taping does not take into any it doesn't fit into a physiological understanding of how muscles work, right? Putting a sticker on a skin in the name of a tape, thinking that it will influence muscle, there is no physiological basis for such a claim. Now, can we say that in future it will show? On what basis physiology is going to change? Now, muscles are going to be activated by just touching the skin. Now, these are all the questions that we need to ask, that in future why we expect a better evidence might come. Now, I think most of the time people come up with this argument because they are not exploring why currently it's not supporting. Now, the other way to look at is it doesn't matter. Let us say, hypothetically speaking, that in future it may come and so on. As a clinician, it doesn't matter. Evidence-based practice is a model, or it's a clinical decision-making tool, right? I'm a clinician. Now I have to decide a treatment. On one hand, I have a treatment that I have been giving conventionally. I've been giving as per certain treatment. On the other hand, there is a new treatment has come. Sorry. So for the current treatment, I have certain amount of evidence supports. On the other side, you have a new treatment which at present doesn't have support. Now, what should I do? What's the logical step? I will continue with whatever current evidence or whatever current treatment which I'm giving, which has certain evidence, and I will wait for new treatment to prove that it is effective, right? I think that's the rational decision. We are thinking, if you are thinking that in future it may come, right? Again, the question is why it is not, why we don't have support. Right. So, and also if you look in the history of, especially in medicine, scientific evolution, we have lots of treatment which is initially thought to be effective. Later evidence shows that it is not effective, right? We very rarely had some treatment which is initially thought to be not effective. Later it is found to be effective. So it's just a hypothetical argument. There is no value in it. Right. The next question is, what is your advice on teaching of successful persons in the rehabilitation field who have a lot of success stories using approaches that do not have strong evidence? Right. There are two things to it. First, successful persons. Right. Here, success is defined as a financial success. Somebody who is financially, a therapist who is financially more successful and he's teaching treatment. It doesn't have effect, but he's successful. Why don't we follow? Right? The question is success. Success is defined as what? Right? In my view, success should be defined as the patient improving their outcome. Right? Now, if there are other ways also one can be successful in terms of financially, that we can overcharge a patient, we can give a treatment that is not necessary at all. Excessive modalities we can add and charge for each modalities, and we can become financially successful. And if you're asking why don't we do that, right? You understand the kind of question it is. Now, is that what we want to do? That if you are going to a hospital and the hospital is becoming successful by taking so much of money from you, which is by giving treatment or by charging for a test which is unnecessary, in some case harmful, is it okay for us? Is it okay in the name of a hospital becoming successful? We will pay it, right? So I think there should be no problem in any clinician earning money, becoming financially successful, that's no problem. We can charge, we can earn money in which is acceptable, which is reasonable. That is what it's right. Whatever treatment, if you are highly skilled, you can charge more, earn more money. But the reasoning that somebody is giving all sorts of treatment and he's becoming successful, why don't I do that? It questions the whole purpose of education, right? Why do we even get educated? We can just join as apprentice with people who are earning more money and practice it. Now we need to reason out, right? Reasoning is necessary. Secondly, there is fairness and justice is important. What we do, it has to be a fair practice, right? So within the realm of, if it is fair practice, you charge what you think deserve, it is fine, right? But if it is charging is unfair, now I really don't know if we are thinking of, even if it is unfair, can I do that or not? On the other way, if somebody is thinking, are they successful because the treatment that they are giving effect is working? Let us say the electrotherapy mostly having quite a questionable evidence. So do we think they are successful because they are giving all this treatment? Now next question is whether whoever giving all the treatment which doesn't have evidence, all of them are successful. So I think we are misunderstanding the reason for success. They are not successful because they are giving treatment. They are not just successful because they are giving treatment that doesn't have evidence. There are other reasons why they are successful, right? So I hope I am clear. And the third question, how do you see your belief-based ancient traditional treatment approaches like Ayurveda, which is not having a creative origin history? Many speculate that there might have been a sophisticated research system those days which might have derived these equations. Can we follow them? Give a special note on conditions like COVID. Now, I do not specifically want to comment on a particular system of medicine, because as a clinician and even as a lay public, it doesn't matter what system of medicine that is being given, whether it's a modern medicine, Western medicine, Eastern. I don't really think such divisions is necessary from the patient point of view. From the patient point of view, there are only treatments that produces a good outcome. There are treatment that doesn't produces outcome at all. There are treatment that produces bad outcome. So it doesn't matter for clinicians whether it is a particular system of medicine. If we have evidence that particular system of medicine is improving care, then we can go on about it. If it doesn't improve, then it doesn't matter whether it's Western or Eastern, this system, that system. So our criteria should be treatment improves outcome or not, is the evidence is supporting, right? So that is what I would say. Okay, right, the last okay, so these are all overall answers to this, and I just want to add a final comment, that is evidence-based practice is not an ideology, right? We cannot think this is an ideology. There are alternate ideologies there, we should consider that and that. It's not an ideology. It is a clinical decision making tool. It just encourages clinicians that we have to make decisions keeping the patient's outcome, patient's welfare in the center, and use evidence. When we say evidence, it is more likely to be right. That is what we mean. These are facts, established facts, right? So I do not see this any other way. That is, there is a Western form of medicine, Eastern form of medicine, or any other way, right? It's a very straightforward tool. Okay, that's all I have. Hope I was clear. Thank you.